me what the success rate is, and our success rate is comparable to the AccuDetect's programs for addiction. And that means that it's, I would say, in terms of my own experience, my own past experience of doing psychotherapy, that it's about twice as successful as anything that I could do previously using talk therapy alone. Now, I've never been one to use medication, but I'm comparing it to talk therapy, and it compares very well. If people refer to us, they will get a complete report when we're finished, a very comprehensive report on how to work with the patient that comes to see us, because we have a very clear idea of what the patient needs by the time they've left our program. And as a matter of fact, the patient will usually need less from their care provider in this realm, at least, because in many ways they become their own best counselor. We decided to do this through telemedicine because it created an efficient way of going about this. We get groups together, and we want people to be able to come together in one place, and we want to be able to reach them from our offices in any place in the world. And so the Ontario Telemedicine Network seemed to be almost the perfect medium to do this program. I think you'll find that when you look at the program, and you can look at the other things other than just what I'm saying here, that you'll find that this is a program that is well worth your patient's interest and your interest as well. AccuDestress takes 15 to 16 sessions of ear acupuncture to weave its magic. When people come for an hour 4 times a week, they sit around in a circle with about 8 to 14 other people, and the first 3/4 of an hour they have a quiet time with the acupuncture pins in place, and then after that they engage in a lively conversation, such as the following. And people do ask.
The amazing thing that I found about this exercise is that when you get into it and they ask you right now, all that planning was the past now when you were planning, and then right now it's something different. And I was amazed at the progression. The first time I did it, I was very self-conscious, and the second time I did it, which is right now, I just felt very content, and I didn't feel self-conscious.
I just really felt present to what I am feeling now, and so it was a real experience for me, and I appreciated my comfort.
I think this is something I'll take away with me and ask myself from time to time, who am I being now? I think that's what I'm getting from this. Is
I am aware, or was aware, that of feeling the pull to go inside and to drift somewhere, and it was like a deep feeling of wanting to close my eyes, which I did periodically, and go inward, as if there were there was a flow which I could feel.
In the course of just 1 month, and in a very relaxed way, in a way that people quite like it, some quite profound changes occur. These changes continue well into the 6 months following, and when we measure their mindfulness scores along the way, by the end of the 1 month session, people have usually doubled up their mindfulness score, and by the end of 6 months they've tripled their mindfulness scores, which is quite comparable to other programs such as the one that is run by Kabat-Zinn.